Today we're going to talk about the Herxheimer reaction or die-off reaction. This can occur from a variety of issues, usually bacterial or viral in nature, but it's a reaction that the patients are going to have when their immune system reacts to the toxins or the endotoxins that are being released in large amounts of pathogens being killed off. And if the body doesn't release or eliminate those toxins quickly enough, they're going to have a detox reaction or a Herxheimer reaction, or sometimes we'll call it a die-off reaction. This remains of a low-life organism that ceases after life. The die-off can contain the toxins inside the organisms, or the dead organisms themselves can create the die-off reaction. And sometimes the dead cell is filled with cell dwellers or toxic waste. And if it's an infection that produces neurotoxins, there can also be neurotoxins present. So this is sometimes seen in viruses, bacteria, spirochetes like Lyme disease, protozoas, fungi, rickettsia, or other parasites. This can also occur from any living low-life organism that can die off and create a toxin, or sometimes we'll call it a biotoxin. So if we want to summarize what this reaction is, it occurs when the body is trying to detox and release toxins, causing an exacerbation of symptoms that are being treated or created in their own symptoms. The important thing to note is that it's a worsening of symptoms. That does not necessarily indicate there's a failure of treatment in question. That's actually the opposite. Oftentimes our patients will feel worse before they'll feel better because of this die-off reaction, but we can make them feel better faster if we increase the body's ability to detox at the same time. So the history of the Herxheimer reaction, the phenomenon was first described by Adolf Herxheimer working in Vienna, Austria, and a few years later, Karl Herxheimer was working in Frankfurt, Germany. Both doctors were dermatologists, mainly treating syphilitic lesions of the skin. And they noticed that in this response to treatment, many patients developed not only fever, perspiration, night sweats, nausea, and vomiting, but their skin lesions became larger and more inflamed before settling down and healing. Interestingly, they found that those who had the most extreme reactions healed best and fastest. And the patient might be ill for 2 to 3 days, but then their lesions would resolve. What we will typically see is an increase in symptoms that can last about 5 to 7 days, and then it starts to get better, and then it may come back again in a 2 to 3 week period of time, and they'll have this reaction happen again. It usually occurs with the die-off cycle of the bacteria itself. So in the process of die-off, a spirochete, which is what is found in Lyme disease, which is an alive living organism within the cell, alters the cell. It can reproduce in the cell. It creates waste and it releases neurotoxins. And some of these organisms live in the blood and outside of the cell. An eradication of the agent comes along and penetrates the cell and kills the spirochete. That can be an antibiotic, or it can be the herbs that we're using to kill the spirochete as well. When the cell dies, the cell itself can burst open, and out of that, the dead spirochete or baby spirochetes, all cause toxic waste of matters, will be released into the body. So it's actually the waste within the cell body that floats into the surrounding fluid, which is called interstitial fluid. This interstitial fluid is constantly being drawn into the lymphatic pathways to be filtered by the detoxification system. In a spirochetal infection, the fluid is thickened by the organisms, causing the die-off to move exceptionally slow through those pathways, so that that bad matter or that toxic matter remains in the body or in the lymphatic pathways for a longer period of time because it's stagnant and it becomes blocked. The die-off must have opened the lymphatic pathways to leave the interstitial fluid, causing the blocked lymphatic pathways, which are known as lymph flukes. Too much die-off can be created at one time, and an inflammation caused by neurotoxins can occur. Usually what helps with this is the lymph system being stimulated with aids of a pumping movement into the interstitial fluid into the lymphatic system. So oftentimes we'll tell people to do lymphatic drainage with dry brushing, or we'll have them do lymphatic massage. We'll have them bounce on a mini tramp or do a light jump rope, something that helps to stimulate that lymphatic system so that these things can get processed and moved through. Once die-off leaves the lymphatic system, it goes into the liver, and complications of detox can be present if the liver pathways are not opened and they are clogged as well. Die-off is not excessive. It'll move through that detoxification system very quickly. If toxins are made less toxic so the body can handle it, the pathways are narrowed or blocked by inflammations, flukes, stones, cysts, or damage, the die-off of toxins will not reach the liver to be processed. And then these raw potent toxins will recirculate as they wait their turn in the liver to be dumped. So this is why we will typically use things like milk thistle or NAC to help move or clear things out of the liver quicker so that these toxins can move through. From the liver, the endotoxins will move on to be expelled through the intestines, kidneys, breath, or skin, but only if their pathways are opened. If not, the die-off toxins cannot leave the intestines because of blockage, such as constipation. Then the toxins are trapped, clinging to the walls and attached to the nerves in the colon. And these toxins can cause the person to feel ill as well. So oftentimes we will use things like bentonite clay or activated charcoal fiber to help them move things through. Sometimes we'll use Picana drainage kit as well, which is a detox kit of homeopathic remedies that's going to help remove toxins from the kidneys, the liver, the pancreas, the spleen, and the colon as well. Most of the time when we use these kind of methodologies, it doesn't increase diarrhea for the patient. Oftentimes it can constipate them unless we add some magnesium citrate. Then that helps move some of these things through so that they don't get constipated and reabsorb a lot of these toxins. If the toxins cannot leave the lungs because of blockage, such as a fungus, mucus, parasites, smoking, mold spores in the environment, viruses, damaged lungs, or lack of pumping air out with activity, then the die-off toxins are trapped, clinging to the walls and attracted into the nerves, which will cause inflammation. This will trap the toxins and cause the person to feel short of breath, or you'll often hear us say, ask the patient if they're having air hunger. That's how they'll feel if things are trapped inside of there. If toxins cannot leave the skin because of a blockage, such as the inability to sweat, then the toxins are trapped into the skin. And the skin being the largest organ, it's not uncommon for us to see rashes or acne or different processes of the skin, like we call it a Bartonella rash, which looks like stretch marks, occur as well. And then the best thing to do in this case is get people to get into a hot tub of water with Epsom salts in it, or get them into infrared sauna to help them sweat out these toxins. If the kidneys can't detox the toxins as well because of a blockage or inflammation, the neurotoxins can injure the kidneys as well. And the biggest problem here tends to be lack of fluids. So people need to stay very hydrated. If they're getting too dehydrated, they're going to have more problems within the kidney. And oftentimes we'll see bladder spasms, or people will feel like they have a bladder infection, but they're just not moving those toxins. So it's creating problems in the bladder itself or in the kidneys. Stuck, die-off, or recirculating toxins can cause flu-like symptoms because the body's sick from the poisons and the toxins, and the body reacts to these potent toxins by manifesting symptoms of flu-like illnesses like the Herxheimer reaction. Symptoms of the die-off reaction are feeling worse before they get better, regardless of what their symptoms are. Typically flu-like symptoms, headaches, fogginess, muscle spasms, muscle tightness, ligament contractions, burning tendons, irritation of the eyes, redness, itching, watering, double vision, blurred vision, floaters, ringing in the ears, itching, rash, flushed face, warm, hot flashes, swollen glands, cold extremities, fever and chills that go off and on, or just chills without the fever, night sweats, increased mucus secretions, inflammation, nausea, vomiting, constipation, bloating, stomach pains, diarrhea, loss of appetite, difficulty swallowing. Some people will actually have an elevated heart rate or a rapid heart rate, fluttering and heart palpitations, irritability, moodiness, restlessness, tiredness, dizziness, weakness. Some people will get what we call Bartonella rage. They'll get depression, severe anger for no reason, sadness, anxiety, OCD, fear. Suppressed memories can happen, fatigue, insomnia, and many more can happen as well. So, what do we do for detox and Lyme die-off parasites, Candida? Bentonite clay or Redmond clay, activated charcoal can be used. These things need to be taken a minimum of an hour away from food supplements or medications because they bind to those things and they can cause problems with those medications and herbs not working properly. Chlorella can be used. Picana drainage kit works really nice. It's a homeopathic remedy. It's liquid. You pour about 20 drops of each vial. There's 4, I believe, in the kit into some water, and they drink that down. They can sip it over a period of time, or they can just drink it down straight in out of a shot glass. Hot lemon water works really nicely. Far infrared sauna or a biomat. Detox foot baths work really well. That's something we offer here in the clinic, or patients can actually buy a detox foot bath kit at home. A lot of times we'll have them go to Amazon and purchase one. They can do detox foot baths every 72 hours. OnDemand has programs that we can run for detox as well. Magnet therapy and dry brushing and lymph massage work really well. Dry brushing is very easy. You get a bristled brush like you use for washing your back in the shower, and you use it when it's dry, and you do this just before you get into a hot shower or a hot bath. Start at your feet and lightly brush up with strokes, very large strokes coming up and in towards the heart. And that gets the lymphatic system moving. And then the patient gets into a hot shower or a hot bath, and that drains that lymphatic system for them. So lots of things that we can do for detox. Encouragement for patients is important as well. We need to encourage them to hang in there. If things are really bad and we can't get them to detox, then we will decrease what we're giving them. But if they can tolerate it and we can increase detox, we want to do that before we just automatically drop their dosages down. If there's any questions ever about whether or not a patient should implement detox or decrease their dosing, please ask the practitioners or ask one of the medical support staff that has been doing this a long time. They can help you determine what's the best way to deal with detox.